How prepared was Africa for the pandemic, and how has that transferred to how it is managing or controlling it?
Yeah, thanks, Lozen, for the interview. Africa was, unfortunately, because of our weak healthcare system, I would say that Africa was not prepared for such a pandemic. I mean, not at all. Our health systems continue to be challenged by even the endemic diseases that we had before COVID, the likes of HIV, TB, malaria, the rising rates of non-communicable diseases like the cancers, the diabetes, and the hypertension. So with this fragile system, I mean, it is hard to say that Africa was prepared. However, Africa went into this quickly. They reacted very, very quickly to this, and actually was privileged because we saw this happening in China over December,
yes,
in Europe, and it was like a fire, right?
Yes.
Going from China to Europe, and then by the time it came, he arrived Africa in February. We knew that it was coming, and when he arrived, we saw it coming on the continent. So the first cases of COVID-19 showed up on our continent on the 14th of February in Egypt.
Yes.
And at that time, we Africa CDC had lined up ourselves up. I think we had selected countries that had direct flights with China, and nearly all of them, and trained them in Senegal on how to do the diagnosis. Remember, there were no cases when we did our first training on the 8th of February in 2020. No, nothing. And no, I think people usually say two countries. At that time, there was really no country in Africa that had the capacity to test for COVID. What I mean capacity, I mean the reagents to test it. There are many labs in Africa. I just want to be sure that people don't put that out of context.
Yes.
But the reagents for test for COVID were not there. So we look at the movement. I would say, this flight is going to China. I mean, like from Egypt, South Africa, Mauritius, Morocco. Let's train all of them. So we took them to Senegal and trained them, and then they went back home with 100 tests.
Yes.
It's a test kit. I mean, it may sound like you say what 100, but it was 100 tests that, as we call it, the starter kit. So you go home, yes, and if you have, and luckily, when the first cases showed up in Egypt, they were the people that were trained in Senegal with Africa CDC that started doing the testing in Egypt with the test kits that we had shipped to them. So that's how then we did another training in South Africa, and then within a couple of weeks, the whole continent was able to test for COVID. So the point I'm making is that the continent was not prepared, but we moved into full scale because we knew it was going to hit us. I think there's a paper that I can send to you,
yes,
which I wrote in January and published in Nature Medicine,
yes,
which that is interesting because at that time, there were only 200 cases of COVID in the whole world. I wrote in that the Nature Medicine is a very high impact journal. And I said, Africa will need to be prepared because this virus will show up on the continent. And it did.
Yes,
there were 200 cases in the whole world, so, and at that time, still only around China and Thailand and Hong Kong. So it only shows you how quickly viruses can spread and how a threat anywhere in the world is a threat everywhere in the world.
Yes, yes, yes.
Another very important thing that you must say about Africa that is really not talked about is the political leadership.
Yes.
Under President Ramaphosa, when he was chair of the African Union, he convened about 15 meetings of head of states. They called it the Bureau of the Head of States to talk about the COVID-19, where he appointed special envoys like Donna Kaburuka, Strive Masiwa, and Ngozi. He set up the COVID Response Fund. He set up the medical African medical supply platform that Mr. Masiwa orchestrated. So a lot of all the joint initiatives on the continent. Our part as Africa CDC was to elaborate a continental strategy. his part was to champion that continental strategy, and with all of these elements that I just listed, they were all accredited to his very strong and political. The continent was very lucky to have him as the chair of the African Union at that time. So I think it was really that strong political leadership that elevated our response. Now, let me just finish by saying that the first cases showed up on the continent of the 14th of February. On the 22nd of February, we convened an emergency meeting of all ministers of health in Addis Ababa. All ministers. Some ministers were traveling in Europe. They returned back to Addis Ababa because everybody recognized that it was important. When they left on the 22nd, they left with clarity of purpose. They left with clarity of purpose and action. So when you go back and you get the cases, these are the things that you must do. Like, if you recall that countries like Zambia, Zimbabwe were going on a shutdown where the first cases showed up there. The continental skies were shut down in March and April, if you recall. No, we couldn't travel across the continent because, I mean, why was that important? It was that important not because that is how you fight pandemic, but because we had nothing. Okay, I mean, we had nothing. We had no diagnostics. Okay, by March or so of last year, as a continent, we had tested under 200, conducted less than 200,000 cases, a continent of 1.2 billion. Yeah. So we had to do those measures in order to enable us to stockpile what I call the Covid19 response commodities, like the PPEs, the masks, the diagnostics there. So anyway, that political leadership was extremely important. And together with the joint continental strategy that we developed and the head of states endorsed it, which was underpinned by cooperation, coordination, collaboration, and communication.
And what has happened since? Because as you can see, you know, some of these countries in the West, in America, they're talking about a post-COVID environment. They are back to you know, getting off the mask. They are back to normal life. You know what is happening, and for us, it seems we are going the other direction.
No, sure. What is happening is that, I mean, as you know, Lawson, it's very hard to contain these viruses with only public health measures. Very difficult, because you have to balance between saving lives and livelihoods, I mean, all the time. The only reason that those countries in the West are beginning to look like normal, like you and I are watching the European nations cup and whatever, and people, young people like you in the studio shouting and jumping and hugging, is because of vaccination. They are vaccinated. Okay, the large chunks of their population so have been vaccinated. We have not. I mean, we've only vaccinated fully about 1.1% or 1.5% of our population, which is extremely limited for a continent of 1.2 billion people. So I think that is a very important consideration there. So that, I mean, we did what we could do, but what we were doing with public health measure was to hold the fort. Okay, to blunt it, keep blunting the spread of the virus as much as possible while waiting for biomedical interventions, which unfortunately have been extremely delayed to come to the continent.
Yeah, let's talk about that delay. This vaccine nationalism, and I saw a clip by Strive Masi who are talking about these countries hoarding the vaccines and some of them having more than they need. What, you know, we are used to a world that at least these countries are talking about a liberal trade environment where, you know, if you have the money, you should be able to access what you're looking for. So what is happening?
Yeah. So what is happening is, of course, several, I'll call it headwinds have played against us in Africa. First of all is inability to manufacture vaccines. Okay, we import 99% of our vaccines, produce 1% of the vaccines that we consume, and consume 25% of the world's vaccines. So when you are hit with this pandemic and you are relying on somebody else to produce vaccines, immunize his own people, and then work with you and show signs of cooperation and solidarity, you always suffer. I think that is one. The second thing is that when the pandemic started, they said, okay, We said all the right things in public. We said we want fair access to vaccines, rapid access to vaccines, and then we set up the COVAX mechanism, which is a mechanism set up by the Global Vaccine Alliance, WHO, and the Coalition for Epidemic Preparedness Innovation called CEPI, which the intent itself was very, very good. It was a noble program, which was, in my view, a strong expression of solidarity and cooperation. But the translation was just not up to what it was. For example, the rich countries pledged money to COVAX, but bought vaccines. So whereas COVAX was sitting on billions of dollars, they didn't know where to go get vaccines because they were competing with the same people that had given them money. And Africa was waiting and relying on those public pronouncements that the vaccines will be available through COVAX and 20% of our population will be vaccinated. I think that is where it became challenging, okay? Where Africa believed that their own health security will be taken care of through a global coordination, a global mechanism. The lesson number one that we should learn as a continent is that you must take charge of your own health security.
Yes.
I'll say it again. You must, and I use the word must deliberately, take charge of your own health security.
Yes.
We saw this in 2009 when the swine fever pandemic broke out. Vaccines were available in the West. They only were available in Africa and other developing countries when the pandemic was over. Fortunately, the pandemic didn't last. We saw this in 1996 when drugs to treat HIV patients were available in the West. The rate of mortality was plummeting. But in Africa, it took us 10 years between 1996 and 2005 before ARVs were available. I don't know how old you were at that time, but I remember vividly that I was already in a mid-level in public health in Cote d'Ivoire.
Yes.
And we used to see loved ones. My office was overseeing the infectious disease ward in Cote d'Ivoire, and people would drive in with red taxis, drop their dead ones who were infected with HIV and go away. Because there was no money. It costed at that time $10,000 per treatment per year for a patient. Over 10 years during that period, about 12 million Africans died. So Africa is used to being in a situation that is, I'll call it what I call a moral dilemma, a situation for humanity. And it's very, very unfortunate. And so Africa should learn from that and say, that is why we are pushing that there must be a new public health order for the continent. A new public health order for the continent that does 5 things. One is that we coordinate ourselves to begin to manufacture vaccines, therapeutics, and diagnostics. Second is that we invest in our workforce capital. Invest in our workforce capital, and that way you have a functional public health response workforce on the continent. You can only help yourself. I mean, nobody else can help you, especially during the time of pandemic. You don't expect the Europeans to be, instead of fighting their own pandemics and outbreaks in Europe, be sending people to come work with you. That's why Africa CDC, the creation of Africa CDC is one of the greatest vision and wisdom of our head of state. The third thing under our public health order is to strengthen our own national public health institutions, like the CDCs in Africa. Every country should have its own mini CDC. The fourth thing is we must work with the private sector. Okay, work with the likes of Stripe, Masiwa, and others so that you can harness the power of innovation to address our public health issues there. And lastly, work with our partners, but work in a way that is respectful. That way they honor our vision, the direction that we are going. Our Agenda 2063 is all aligned so that we don't come across like we have a direction we are heading, then a partner comes in and say, well, if only you did these other things, then we abandon our own agenda and you never grow as a continent, right? So I think those are the 5 things that we are saying a new public health order for the continent must emerge from this pandemic so that we build back better, we build back stronger, and we build back bigger.
So far, what you have said, when you look at the experience with the HIV/AIDS, and as you have said, the people who died and those deaths could have been prevented. Now, we seem to be in a similar situation, like you have just said. So I'm worried. How worried are you? Because are we going to lose a similar number of people to a situation that can be prevented?
I'm very worried because I'm very worried, but remain optimistic that why am I worried? Because this virus is dangerous, it spreads very quickly, and we are very delayed in our ability to roll out vaccines, very, very delayed. And my fear is that we may move into endemicity of this virus, which means that the virus seats itself in a way that it becomes very difficult to flush it out. Because again, we cannot live with this virus. Okay, it's not HIV, it's not TB. Okay, you cannot, it disrupt our economies, it disrupts lives, and it kills, mortality is very, very high. So I'm very concerned with that the delays will lead to a situation where the virus becomes endemic. But I remain hopeful that through the efforts that I just described, like the AVAT, the African Vaccine Acquisition Task Team that Mr. Strive Masiwa is heading, we have secured 400 million doses of Johnson & Johnson, and the delivery will start in the next 2 weeks. That is the beginning of August, and it will begin to be very predictable and consistent, so that in the next coming, by the end of the year, you see a significant number of people begin to be vaccinated. In a manner that is not interrupted, because you need that predictability to be able to plan to scale up vaccines. Say, for example, I don't know where you are based, but if I came to Kigali, I was there, by the way, a few weeks ago, very impressed with how much people were wearing masks and the compliance there. But if I came to Kigali and I said, please go to the beautiful sports arena and get vaccinated and vaccinated. And then people go there and they run 5 vaccines. Then the next time you tell them to go, they will not go. So that is the predictability of vaccination programs that we want to see. Rwanda, for example, you got your vaccines, the first doses of AstraZeneca arrived, and within a week or 2 weeks, they were all used up, right? About 290,000 doses of vaccines they disappeared like that. Pfizer, 102,000 doses, 50,000 doses were gone within a short while. When I was in Kigali, went to the warehouses of vaccines, you could only see the deep freezer that was standing there was full of doses that were waiting for the second immunization there. So it can be done in Africa. We should not get ourselves in this, we should not accept this characterization like, oh, because of vaccine hesitancy in Africa, they are not using their vaccines. If throw in vaccines in Kigali or Rwanda today, it will be gone within 1 month. Throw in vaccines in Nigeria, Ghana, Togo, they will be gone like that. So Kenya, I mean, and many, many other places there. So we should really not be, the narrative that vaccine hesitancy is what is delaying vaccine program in Africa is false. People don't even have the vaccine, so how can they not use the vaccines? And we have seen in countries like Cote d'Ivoire where there was initially reluctance, but when people saw that people have received vaccines and they were okay, they just, you saw that the rate of acceptance. Africans are used to vaccination. The only reason you and I are alive is because we have, how many times have you been immunized?
Yes,
I've been immunized about 10 times with different kinds of vaccines.
Yes,
that is the only way we survive. We live in a hostile tropical environment that only vaccines have saved us. So we are not going to even accept that characterization that we are a continent with that is driven by vaccine hesitancy.
I'm interested to hear your view of what you think drives that myth about hesitance. And also, if you could talk a little bit about the logistics challenges. To what extent have they been an impediment to effective vaccination?
The logistic challenges is, let me start with that, is because as a continent, we have never immunized about 200 million adults in 1 year. Remember, the vaccines that you and I are used to receiving are vaccines for childhood immunization, like the measles and even yellow fever. When you need it for travel, it's not like a scare. So we are not used to having that. But Africa is a resilient continent. We can use those vaccines. I just cited the cases of countries that organize themselves. It's a question of organization. And you do that. You set up vaccination centers. You pull young people from medical school who are finalized the end of their training. bring out people who have retired, the nurses and doctors. That give you your surge capacity. You support vaccination centers there. I mean, and you get it done. I mean, it's not impossible to roll these vaccines out, but we have to have a predictable source of vaccines so that we can plan. You don't plan in a vacuum because all these vaccines some come with -20, some with -80, some at 4 degrees. So I think that is what I'm calling on. So I think that is, and it can be dealt with. Our communities are very resilient. They work. They can easily work with us if they see value in work with us, meaning public health and policymakers, and to roll out vaccines very quickly. So yes, the logistics are there. We need to factor that into the scale of vaccination, but it's not an impossible challenge.
Look, on the myth, what is driving this myth of acceptance?
I don't even think there's a myth there. I mean, I've said, it's just that people are mischaracterizing us. And I think that, I really don't know what is the undertone there. Let me give you facts, yes. Okay? Because we've received as a continent about 61 million doses of vaccines. And of that number, 80% of the vaccines have been consumed. At least 80% of the vaccines have been consumed. So it only tells you that if the vaccines are here, you use it. Now, are there pockets of resistance there? Yes. But it's unfortunate that anyone would take a pocket of resistance somewhere and then project that as the continental hesitancy across there. That is the myth there. It's no myth that is that people want to play out the hesitancy in their own, these Africans are not using vaccines and whatever. That's not correct.
The issue about predictability of the vaccine, of course, as you mentioned, manufacturing is a key answer to that. How hopeful are you that this is going to be implemented? I think in the past we've had situations where, as Africans, African Union and so on, the answer is clear, but the ability to mobilize forces.
We are mobilizing now. I think a good starting point would be, if you remember that historic meeting we had on, when was that? On April 12 and 13, where 40,000 people on a platform that, in my view, during this entire pandemic that we started using platforms, I've not seen a platform that brings in 40,000 people. So why was it? It was on the vaccine summit, vaccine manufacturing in Africa. 4 head of states were there, President Ramaphosa, Tshisekedi, your president, Kagame, Macky Sall, and the chairperson of the African Union. So that was a historic moment. Since then, what has happened? We now know that there's a hub now going on in South Africa for manufacturing. Rwanda has the strong will, political capital, and the determination from the highest level to get vaccine manufactured in Rwanda, and we are very supportive. Senegal, Egypt is already building partnership with the Chinese to manufacture the Chinese vaccine. I was just told today that Morocco is in the process of manufacturing vaccines. Algeria and Ghana is geared to do that. We just last week we had a meeting of about 12 African countries that all came together, and we said, look, if you all want to manufacture vaccines, come together and we have a conversation. They all came together, we had a conversation there. So we are making progress. It is a fact that we will make this happen.
We hear that the vaccines may not get to us until 2025. What reassurance can you give Africans? Some hope about...
No, absolutely. Africa, we are resilient people. Count on your own. And you have counted on us. You trusted our vaccines. We'll start rolling in a very systematic way, starting from the beginning of August. With the AVAC mechanism, the other donations and pledges can come in to support us, but the backbone of our vaccination program will be driven by ourselves, by the African Union AVAC mechanism there. And again, just next week, we'll begin to see distribution of some doses that are coming in from Johnson & Johnson, which is all vaccines that would have been procured and paid for completely by Africans, for Africans. We will not wait until 2024 or 23 to have vaccines there. They can be assured that. When the vaccines are available, please go get your vaccine. I have mine already, so I'm good to go. If you vaccinate yourself, you are vaccinating your loved ones.
Yes.
You are protecting your loved ones. I think you vaccinate yourself, it means I love my neighbor. I love my family. I love my loved ones. That is the meaning of actually getting yourself vaccinated. So it's not just about protecting yourself, but it's protecting your loved ones.
Indeed. Thank you very much for your time. Pan-African Review, we are very proud to have gotten your interview and for the time that you have given us. And we invite you actually to use the platform, Pan-African Review.
I will subscribe to it for sure.